People will frequently come to the office and request a rejuvenation of their face in broad terms. And it's up to me to really look and analyze the problem and try to get them to be more specific about the certain areas that bother them the most. We have a number of possibilities. We can do brow lifts, we can do blepharoplasty, that's an eyelid lift. We can do facelifts and neck lifts. But we can also do things that are less invasive than that. We can do fillers and injections, and we can use Botox, and we can do peels.
The problem I had was I started to look tired and old because my eyes were developing these flaps over my eyes, and I didn't feel old, and I looked old, I looked tired. I had these little flaps over my eyes, so now I don't have them. And they said, boy, you look good, and because I feel good. And a lot of people looked at me and they had no idea that I've done any work with my eyes.
The tip of my nose was crooked, and so it was a revision because the first one that was done something happened to it, and it was getting worse and worse. It was twisting. He was able to show me on my face, you know, with his fingers and with explanation, what he could do. And that, I think, to me, is far more important than showing me pictures of all these other people.
I noticed that I had some jowls and some circles and, you know, just natural aging, and so I decided to consult with Dr. Boyd about what the possibilities were, and he recommended a facelift. Well, after the recovery from the surgery for my facelift, I noticed that I looked brighter, and there wasn't the sagging, tired look that you get on your face when your skin sags, and particularly around the mouth and the jowls. And I had a history of dark circles and bags under my eyes, and that was also remedied for the most part.
I had crow's feet in between my eyes right here. I have children that are younger, so I felt like I needed to not look like their grandma. He explained to me what Botox would do, what fillers would do. He gave me information on all the things that are out there and what he thought would be best for my situation.
I'm 60, and most of the buyers and the people I work with are creative in their 30s and 40s. And I want to be engaged. I don't want to seem like an old guy looking to retire, because I have no plans to retire. So you know, it's also good for my social life. So I just feel younger, and I don't feel my age.
I got a lot of compliments on my appearance, and it just, of course, then revalidated what I did, and that I made the right choice going with Dr. Boyd, because he's such a detailed guy, and he's so very, very good at what he does, in my experience. So
I didn't need as much as I thought I did. You can trust him. He's not going to sell you something you don't need.
And I was scared that it was going to just take forever to heal, and I didn't. It's been a month, and my swelling is gone. You can't see my incisions. I bruised maybe for 2 weeks, and that was it. You know, I couldn't believe it. I mean, he's an artist.